So what I'm going to be talking to you about today is counseling and obesity awareness. And since this is a surgical practice that deals with patients both pre and post-op, and some even non-surgical methods of weight loss, I think how we can improve pre and post-op success as well as get the community involved in our mission. I know at the bottom of every email there's a mission statement encouraging, obesity awareness and healthy activities, things like that in our community. For any time you email a patient or a patient emails you and you reply, they see the mission statement. So this is just a couple of ways that I found in looking at our entire practice how to improve upon our mission statement and how to get our name out there in a positive way, just with community service as well as with counseling. So that's what this falls. Okay, so the first thing we do, I'm sure that you guys are aware of this, that obesity in America, American obesity is currently on the rise. The goal of Bariatric Specialists North Carolina is to help encourage and help the community to work towards a healthier future through bariatric surgery, through non-surgical weight loss. The first step is to help the patients through significant pre- and post-op counseling. Now, before any patient has surgery, they have to have a psychological evaluation. And part of what I'm going to talk to you about today is how it could improve our practice if we had an on-site counselor or psychologist working with the patient, not just in their pre-op evaluation, but also after their post-op and through follow-up and working with the patient more closely. Because something that I found when talking with our post-op coordinator, Susan Bowling, and a case manager of the pre-op part, is that a lot of our patients really need that counseling after the surgery because they fall off and they come back to us for follow-up, but having the counseling would be a good way to keep encouraging that healthy behavior so that they don't fall off. Because we've been seeing a rise in revision patients having to get a second surgery. And part of that is these patients aren't doing their follow-up in nutrition and psychology. So that's kind of what I'm going to be talking about to you. Okay, pre- and post-op counseling, that's what I just mentioned. All patients enter the bariatric process. They're required to have a psychiatric evaluation for surgery clearance. Now, what we found is quite a few of our patients seem to know how to get that initial surgical clearance for their evaluation, but they don't return for a follow-up before surgery or after surgery. And then they come back to us for the revision, like I mentioned previously. And what we get from the psychologist when they go back for another psychological evaluation is that they're not eating what they're supposed to, they're not following the plan, they're not sticking with it. So something that could be helpful is to, have an ongoing follow-up. That's so important. And I know we do have people here who follow up with the patients, but having that counseling follow-up is something that is going to help the patient in a little bit of a more, on-track way, because they can actually sit down with the patient and talk about real personal things about what's going on in their life, make goals and plans. That's what a counselor does, is just to make some goals and plans with the patient as to how we're going to fix this problem. So if they fall off, if they go get sweet tea instead of following the diet structure that is set up, the counselor can help them get back on track pretty simply just by setting some goals.
Do you have any information that shows what percentage of people who come back for revision, for instance? I think I understood what you were saying.
Mm-hmm.
Basically, the idea is that people come back for revision, and by continuing ongoing care, they might not need it.
Exactly.
Are there any statistics on those who come back for a revision versus those who don't, or those who are successful weight loss versus those who aren't, however you want to measure that? What percentage of those people actually have ongoing care already?
Well, I've looked through our revisions, and I don't know exactly the percentage that actually already have ongoing care from all of our past cases, but for our revisions, I can tell you that the majority percentage of them, probably at least 75% of our revisions, have not had any psychological or even nutrition, working with someone like our nutritionist here, Patrick, as follow-up at all. And so when they come back in for the revision, that's when you hit that roadblock. Now, the other 25% a lot of times have malfunction, something goes wrong, they, have some kind of irritation with the band, or their staples pop, or dilation, anything like that. But we do have some that have actual psychological issues that are more serious than just not being able to stick with the program, like a diagnosis such as a personality disorder or bipolar disorder. And now those patients usually do have follow-up care, and sometimes they will have a malfunction, not because of the actual surgery, but because they're struggling mentally with something a little more
Right, I understand,
intense.
yeah, definitely.
But I'd say probably at least 75% of our revisions don't do it as follow-up care with counseling.
But I think one of the things you might want to consider is looking at it is the comparison. Because
Yeah.
75% of our non-revision patients also have no ongoing counseling.
You're probably correct.
So that would be a good kind of comparison in order to be able to make a stronger argument.
Mhm.
Does that make sense?
Yes. So, continuing on, what could be very helpful is to have an on-site counselor to work with, not only the patient, but the nutritionist and post-op coordinator to help smooth the patient's experience. Now, what I mean by that is, Patrick on several occasions has come to us from a nutrition standpoint when we're working with certain patients and said, hey, this patient is having trouble with this part of nutrition, and do you know anything about the psychological, where they stand there, or do you have any diagnosis, what's going on? And he has actually even said that when he used to work at a previous practice, he did have that counselor input, and he thinks that would be very helpful just to be able to talk to another professional about some of the patients and what's going on nutritionally and how that relates to counseling. Because he does a lot of the counseling, actually, working with those patients. Okay, and that kind of falls into what I was going to say next. Teamwork is very important to everything running smoothly. Having an on-site counselor can not only help with follow-up care and the pre-surgical counseling, but they can work with the nutritionist to help to have community activities and outreach. The counselor can also give professional contributions to the nutritionist's work. Now, part of what helps just not our patients here, but the whole Cary Apex area is the fact that they all know about, they've heard about bariatric specialists in North Carolina, the name's kind of out there. But in order to continue a positive name with all the American obesity that's going on, having some community outreach with a nutritionist and a counselor could be really positive for not just our practice, but also for the community in general. Now, what I'm saying by that is you could have people who maybe weren't necessarily getting surgery coming in to see a counselor or a nutritionist, working on their obesity, maybe the non-surgical weight loss measures that we have in the nutrition store, things like that. That could be really helpful in not just getting our name out there for surgery, but also getting our name out there for other things. And if the patients do decide to get surgery, they've already got a connection back with bariatric specialists working with a counselor or nutritionist. So it might be a positive outreach into the community to get an idea of the nutritionist and the counselor, if you did decide to go with a counselor in the future, to get patients coming in just to see the nutritionist. Because I know several people need to see a nutritionist that don't go through with weight loss surgery. So, I mean, that could be a positive help in getting our name out there. And then if they have a positive experience, they spread it to their friends. Or, maybe they get to the point where they do decide to go with weight loss surgery, and they go with bariatric specialists or the sleeve center or the band center. Okay, models. I looked at several different models of where they actually have the on-site counselor. That's kind of what the slide just talks about. Duke, I know, for example, has kind of, since it's a pretty big hospital, they have the advantage of being able to have everything housed in one place. And that can be positive for a patient because it makes it easier for them. And something that I've found is a lot of our patients are not going to do something that's not going to be simple for them to get to or to be involved with. So patients will find it more user-friendly for their appointments to have everything in one place. And since they all have to go to a psychological evaluation, having an on-site person would make it easier for that patient to because it makes it easy for them to see Patrick. I know the nutritionist. They can call in, anybody can make an appointment, and they can get in to see him, and so that would make it a little more user-friendly. The lab is made more user-friendly for them to get their labs drawn when they come in for their initial. So that's just what I was thinking of with the models. The other models I've seen are things like Duke, things like Wake Med. They have more of the on-site because they're a hospital and they're able to do that with the radiology and everything. But a counselor would be just another step in that direction, making it a little bit easier for the patient. And I know we talk about customer service and how important that is, and so making something user-friendly and easy for a patient would be a positive. Now, the other thing I said was the practice would be making more money through session payments too, because with having the patient use our practice, that increases the practice making more money, so that's always a plus. If you're going to keep more patients and pay for a counselor and pay for, you have to have some resources to do that.
Do you have any idea how many, or have an estimate of how many patients the counselor would have to see in-house in order for it to make financial sense?
That's actually what I'm going to talk about. I've got a budget up here. I think that's, well, actually, that's okay, we'll get there. But we will get there. But yes. Okay, community outreach. So I talked a little bit about community outreach, and it's just really important. I know we've been doing a lot more community outreach with the Benson Fair that they have, the 5K they have at Alamance. These are just some ideas for the Cary Apex area to get our community involved in the obesity awareness and help make it a more healthy community for Cary and for Apex. I said the epidemic of obesity in the United States is quickly becoming the leading cause of death. And actually, if you look on the leading causes of death in the United States, they're contributed by the obesity, such as heart attack, something like that. Smoking actually used to be the top one, but I think obesity has actually come to the top now, as far as that's concerned. We could use a program for outreach in the Cary Apex community to help deal with the issue of obesity. Now, these are just some ideas for outreach, and you can see my fun picture of people running. They did the 5K at Alamance, and that helped. I'm thinking, and this could possibly happen. These are just some ideas. We could do a community outreach for fighting obesity to help raise awareness. The proceeds could be donated to something like the American Heart Association, because a lot of our patients have cardiac issues and have to get a cardiac clearance, or a diabetic support group. That way, we also have a lot of patients who have diabetes. So those are just two ideas of having something that people could get involved in, where the money actually goes to help support finding something to help cure these people. We could also hold counseling and nutrition open houses for patients to get to know the providers. Now, that might be a good idea for if you want to get other patients involved that are not necessarily surgical patients, or even surgical patients. Say, hey, come in, we're going to have an open house. You can meet our nutritionists and our counselors so they feel comfortable with them when they come in for their session. That was my only thought about the open house. So that might be a good way to get the community involved. And we could even do that with case managers or with surgeons and just say, come in, meet our post-op coordinator, meet our case manager, meet Dr. Enoch, meet Dr. Bruce, meet Dr. Tyner, feel more comfortable with your providers by coming in and having kind of get to know you session, if that makes any sense. Okay, this is the budget. So as far as the budget is concerned, I know it can be tricky. I want to have the basic cost. So a counselor's basic salary is about $40,000 per year. Okay, so keeping this amount balanced out by the patients coming in to see a counselor, what you would have is, I had looked at Patrick's schedule for the nutrition just to kind of get an idea. If the counselor sees 5 patients a day for 5 days a week, and we make a profit of approximately $75 to $100 per patient, depending on their insurance, because usually 1 hour session with a counselor or psychologist is approximately $75 to $100, depending on your insurance coverage, unless you have real good insurance, and then it's less. So in that case, you would be making approximately $2,500 per week. If it's $100, a little less than that, maybe $2,000 if it's $75, because that's just approximately the cost. Per year, that would, if it was $100, that would make about $120,000 per year, and then you would take out the counselor's salary. So it would make approximately $70,000 to $80,000 for just the practice. That's not counting the counselor's salary. But that again is if they have 5 sessions per day that are filled and 5 days a week that they're doing that. So the way you would look at it is, if you could at least have half of those sessions full, you would probably be making a significant profit upon those patients coming in. Now, that again depends on the insurance. It depends on what insurance we accept. And their Medicare can be tricky. I'm not really sure how that falls into everything. But $75 is the low end of the spectrum that I've seen with insurance coverage, and 100 is the higher. You could have a self-pay rate of something that was reasonable, like if you wanted to do self-pay at 100, since that's the higher end of the spectrum. And that kind of falls into everything. And in addition to not just having the patients here, you would also have the band center and the sleep center patients probably utilizing that too. So that's just a general idea. Now, I'm not really sure exactly how much other payments would have to go in. You probably have to purchase a computer. You probably have to purchase supplies and books. So that would be part of that profit. So it wouldn't all just be profit. But that's just an idea of general budget.
That's not, it's probably closer to 60,000.
Well, I was just saying that's mid-level for a counselor. Now, that's not a psychologist. That's a counselor.
I understand.
So it just depends on how much experience, too. So you're right. So if you do get someone with more experience, it's probably 60 to 70,000.
Well, I'd say,
Yeah.
this is something, anyway, I would say that you probably, if you're going to talk about this, that you would probably want to raise that, and all the other part you need to think about when you talk about salary, just so you know, is you also got to incorporate in their benefits and the cost of all of that as well.
Right.
So it's not just their flat rate, it's also their rate times a certain percentage, it's somewhere in the neighborhood of 15 for taxes, and then all their benefits and whatnot. So that's just so you can keep that in mind.
Okay.
If you were doing a broader budget on this, like, you know, an actual, if you ended up taking this presentation to the next level and presenting an actual budget, you would want to make sure whenever you're talking about personnel costs, not just the cost of the salary. It's the salary plus benefits, taxes, and everything else that it costs the practice.
Okay, and so this is just a base salary. That's the first one I could find when I looked up counts. I mean, there are some that make over 100,000 depending on what they do. But let's see, and that I just kept on. That's what I just went over with all of you. Okay, the overall goals. Having a permanent on-site counselor to help the patients from the beginning of the process through your follow-up care portion of the process. It would not only be good for the patients to feel comfortable, but I think it would be good for our practice because it maintains that positive attitude. It helps people feel more user-friendly, and it just helps for the experience to be an easier thing for them. I also said to increase local community awareness of obesity by having more obesity awareness activities that connect back with the practice. And budget accordingly so there will still be a profit made after implementation of this. So that's kind of what I was thinking about when you mentioned the budget is, you know, you have to look at the big picture and see, is this something that our practice is willing to be able to spend money on? Are we going to make enough of a profit for this to actually even benefit us? So that's something for, you know, you guys to decide. But again, if you could find the right person, then hopefully you could not only have a counselor, but you could, if you made additional profit, use some community awareness and community outreach with that. So this all kind of goes hand in hand. Okay, and so that's my budget.
I like to connect back to the practice. I think that's great. That was really good.